rapid rise in infection, critical and severe cases are fewer compared to the Delta variant surge in September. The health department strategy now shifting as COVID-19 infections substantially rise by the day, with the rate of transmission and the Omicron variant now dominating. The agency says contact tracing and testing just to find the infected are no longer a priority. Instead, the primary function of COVID-19 tests now is to help determine the proper clinical management of high-risk patients.
Contact tracing is not that much prioritized anymore because we know that in each household, the possibility or the likelihood that there is one positive individual is very high. So the contact tracing is not that valued or not that prioritized anymore in this kind of situations. Dahil sa napakataas na transmission ng sakit sa ating mga komunidad, yun pong testing, meron po tayong shift into our policies, kung saan tinitignan po natin na mas importante na po siya ngayon for managing clinically our patients, especially the most vulnerable. Ang priority natin ngayon, matest po natin lahat ng vulnerable para mabigyan ng karampatang lunas.
Health spokesperson Rosario Vergere says there should be a focus on community management and isolation to prevent further spread of the virus. Health experts also advise people to isolate immediately as soon as they see the first signs of COVID-19 infection instead of waiting for a COVID-19 test result. Health workers worry about contributing to the surge in COVID-19 cases as they are now forced to report for work while sick. AC Nichols reports the government defends cutting the isolation period, saying it will not put the health workers and their patients at greater risk.
They're supposed to help treat patients, but at the rate COVID-19 is spreading, a number of medical frontliners fear they themselves may be carriers of the virus. It is becoming a cause of concern as hospitals carry out a health department order cutting short the isolation period for fully vaccinated COVID-19 positive healthcare workers.
Meron na po kami mga doktor, mga nurses at attendant na pumapasok kahit wala pang resulta yung kanilang swab. Minsan, katulad po yung isang doktor namin, nag-duty siya kahit tumatahol-tahol pa rin siya. 2 days pa lang siya naka-out sa hospital, na-confine siya for 6 days. After, pahinga na isang araw, nag-duty na siya. Ngayon, ka-endorse namin siya, tumatahol pa rin siya pero nag-duty siya.
Government data shows almost 800 healthcare workers are active COVID-19 cases as of January 9. Most, or over 75%, are mild. Philippine General Hospital employees have officially written a letter to management seeking a reconsideration of the policy.
Kung pumasok ka nun, high exposed ka, hindi ka tinest, pumasok ka lang, wala ka nararamdaman. Pero yung pala, nagde-develop na pala yung virus sa katawan mo. So napakadelikado po nito para sa mga health workers at sa mga pasyente.
Jose Reyes Medical Center employee Christy Domínguez finds the policy unfair and unsafe. Not only are frontliners forced to work while sick, they are also dealing with a shortage in protective gear. Domínguez says they are running low on N95 masks and face shields, and they have been told these are reserved for healthcare workers caring for COVID-19 patients.
Bakit kami po ba, pag pumapasok kami sa hospital, bumibiyahe kami, pagpasok namin sa aming mga hospitals, hindi po ba kami prone, hindi po ba kami high risk para doon, para maka-acquire kami ng COVID?
Health officials meanwhile defend the move, saying that the government will not put health workers or patients at greater risk.
Ang reason naman na naging 5 days yan for the, especially for the asymptomatics is because we believe that on the 5th day, if you're vaccinated, the viral load is very low, you can no longer transmit the virus to, or you are not contagious.
Meron na pong mga ilang bansa na nagpatupad ng ganito rin pong protocol because of contingencies, because of the high transmissibility of the Omicron variant. And we wouldn't want our health systems to be overwhelmed also, and nobody's going to take care of our patients. So ginawa po ito base sa siyensya at ebidensya. Wala pong balak ang ating gobyerno na mapunta sa at risk ang ating mga pasyente at ang ating mga healthcare workers. Ito po ay ginagawa base sa risk assessment ng ating mga ospital kung kakayanin.
The DOH is also studying the possibility of cutting short the quarantine period for those without symptoms and the fully vaccinated among the general public. AC Nichols, CNN Philippines.
The DOH Technical Advisory Group member Dr. Anna Ong Lim says the decision to allow shortened quarantine for asymptomatic and fully vaccinated health workers is prompted by the, quote, extreme need for essential workers, unquote. Many hospitals and laboratories have already been short-staffed as more and more health workers get infected. Another member, Dr. Edsel Salvania, clarifying that implementing this is still up to the hospital's infection control unit. He says other hospitals may assign infected health workers to COVID wards as this is less risky. President Duterte wants to increase the government's RT-PCR testing capacity, asking the health department to buy more machines for this. Here's the president in his own words.
We also need to increase the RT-CPR testing capacity in NCR, plus areas so as to handle the influx of tests and to ensure that laboratories are operational 7 days a week. Ang universal complaint talaga is kulang ang facilities ng itong RT-PCR. We need to buy more, you think, sir?
Yes, our expansion is ongoing because we would want that every province will have an RT-PCR, but also the private sector is building more RT-PCR laboratories. So in all, we have 312 laboratories from 1 to 312.
Sige, bili ka para makatulong tayo sa marami. Finally, the National Vaccination Operations Center is directed to increase vaccination rates outside NCR as soon as possible.
For now, the health department is asking testing laboratories to put a cap on the number of swabs accepted daily as more health workers in hospitals and testing facilities get infected. An overseas Filipino worker laments how prolonged quarantine restrictions have prevented her from immediately reuniting with a departed loved one. The government admits testing backlogs are some of the reasons many OFWs are stranded. Krista Nadalo has that story.
Here's one grieving mother's last-ditch effort to see her daughter for the last time. Ella Alagos, an overseas Filipino worker from Lebanon, exhausts all means to attend the wake of her 7-year-old princess. Ella tells CNN Philippines that she was able to talk and see Princess through a video call before the kid died on a hospital bed.
Gusto ko po sana makasama yung anak ko. Siyempre kasi masakit para sa akin bilang ina. Kaya sinikap ko kahit mahirap, umuwi ako. Pero yun nga, pagdating ko dito napakahirap naman. Na ganito naman yung sitwasyon mo, hindi man na mabigyan ng favor, hindi man na mabigyan ng maayos na assistance.
Ella arrived in the country on January 1, but due to stricter quarantine protocols triggered by the Omicron variant, she needed to stay under quarantine for 10 days. But she faces more challenges because after finishing her quarantine, her flight going to the province was cancelled due to the COVID-19 restrictions.
Mahigit 4 years na, hindi ako nakauwi dito sa may Pilipinas. Pagbalik ko, ganyan na yung sitwasyon ng anak ko, pero hindi man nang mabigyan ng favor na sa ganitong sitwasyon, walang exemption sa mga ganitong sitwasyon.
Everyday opportunity is lost for Ella to see her daughter and say her last goodbye.
Yan lang sa ganitong pagkakataon, sa huling pagkakataon na makasama ko po siya, kahit sa maiksing panahon. Ngayon, kaya pinilit kong umuwi.
The Overseas Workers Welfare Administration or OWA admits that many OFWs are now stranded in quarantine facilities due to testing backlogs and cancellations of flights.
In the critical level, when we hit around 10 to 11,000, kakayanin pa naman din yun. Kaya lang, ito na talaga yung levels na talagang we will feel the pinch, no, in terms of yung quarantine facilities natin available.
This is also not the first time the agency receives appeal for shortened quarantine from returning OFWs with emergencies and personal concerns.
We, of course, commiserate and empathize, no, with OFWs who have lost a loved one or have a loved one in hospital. However, we have to also understand the overall situation. And we receive about 100 or 150 requests every day. But not all are granted. Only a small percentage are granted by the Bureau of Quarantine, not by OWA.
Krista Nadalo, CNN Philippines.
The government limits the purchase of over-the-counter medicine for fever and flu because of high demand and to prevent hoarding amid the surge in COVID-19 cases. In a joint memorandum issued by the Trade and Health Departments, a person may only buy a maximum of 20 paracetamol tablets and 60 for each household. For liquid paracetamol, an individual can only get up to 5 bottles and 10 for one household. We're showing on your screens other drugs included in the purchase cap. This comes in the wake of temporary stockouts as Metro Manila remains the country's COVID-19 epicenter. The policy will help prevent artificial shortage and price escalation, as well as ensure the availability of the products until supplies become stable. Retailers are directed to advise consumers about the purchase caps by posting notices within their outlets. Up ahead on Newsnight, MRT3 passengers can now get free COVID antigen tests. We show you how. And 6 inmates at the Caloocan City Jail are dead following a riot. Details when we return. Welcome back to Newsnight, where we go above and beyond the headlines. As coronavirus infections spread relentlessly, one of Metro Manila's biggest rail lines begins testing passengers. Our Rex Media has the details.
If you're taking the MRT regularly, you can volunteer to undergo a free antigen test before buying your ticket. You can also be chosen randomly by MRT personnel, but they will ask for your consent if you're willing to get tested. If not, they won't force you and you can still take the train. But if you say yes, you will be asked to sign consent and contact tracing forms before your swab samples are taken. Medical personnel from the South Superhighway Medical Center will conduct the test. If you test negative, you get a free train ride. If you're positive, you won't be allowed to board the train. Instead, you will be sent home so you can isolate. You will also be asked to coordinate with your local government for proper monitoring and confirmatory RT-PCR tests. The free antigen tests are only available during rush hours, 7 to 9 in the morning and 5 p.m. to 7 in the evening. The tests are conducted at the MRT stations of North Avenue, Cubao, Shaw Boulevard, and Taft Avenue. They will be offered until the end of January, except on weekends. The MRT is reminding the public, while this will give people a chance to be tested for free, always observe minimum health standards at the station, since many MRT personnel and passengers have recently tested positive for the virus. Rex Remitio, CNN Philippines.
Interior Secretary Eduardo Ano orders a high-level investigation into yesterday's Caloocan City jail riot that left 6 people dead and 33 others injured. Caloocan City Police say a heated argument between members of the Commando and Sputnik gangs triggered the scuffle. They say the investigation will cover security camera video testimonies of jail officers and other witnesses. Twinkle Dargani, an executive of the controversial government supplier Pharmally, has been released from Senate detention for humanitarian reasons. Senate President Tito Soto and Blue Ribbon Committee Chairman Richard Gordon approved Dargani's release Monday night after her mother expressed concern for Dargani's mental health. Majority and minority leaders of the upper chamber concurred with the decision. Soto says Dargani's mother has promised to present her to the Blue Ribbon Committee when needed. Senate President adds Dargani tested positive for COVID-19 but has very mild symptoms. Dargani and her brother Mohit were arrested last November after being cited in contempt for refusing to submit subpoenaed financial documents. The Commission on Elections is investigating allegations of hacking which may have compromised voter data and other information related to the 2022 polls. This after an article by the Manila Bulletin claimed an unidentified group of hackers was able to breach the servers of the COMELEC, downloading more than 60 gigabytes of data. COMELEC spokesperson James Jimenez questions the claim, saying the data still does not exist in the full body systems because the configuration files have not yet been completed. He invited the authors to provide further proof on the allegations. Jimenez did not confirm whether Manila Bulletin reached out to him regarding the incident, as stated in the online report. Some presidential aspirants express alarm over the alleged hacking of COMELEC servers. Senator Ping Lacson says the upper chamber's in-house cybersecurity team is already probing the matter. Senator Manny Pacquiao says Congress should exercise its oversight powers in the automated election law. The camp of former Senator Bongbong Marcos calls on the COMELEC Steering Committee and Joint Congressional Oversight Committee to convene and initiate a probe into the alleged hacking. Vice President Leni Robredo and her running mate, Senator Kiko Pangilinan, are asking the COMELEC to verify whether the hacking did happen and to ensure the integrity of the May polls. Meanwhile, Robredo slams disinformation as social media posts claim her office's Bayanihan e-Consulta program gathers the personal data of patients, including voting precincts. And Pangilinan says he tested negative for COVID-19, adding his positive test results from last weekend turned out to be false. The Food and Drug Administration has granted a compassionate special permit for the COVID-19 treatment drug Paxlovid. It is the first generic version of Pfizer's Paxlovid. FDA officer in charge, Oscar Gutierrez, says the agency has approved the application of the health department for the institutional use of the cheaper antiviral pill. Paxlovid may be used for COVID-19 patients aged 12 and above with mild to moderate symptoms. It can reduce risks of hospitalization and deaths by 88 to 89% within 3 to 5 days from the onset of symptoms. Gutierrez says the treatment pill will be distributed through the DOH and government hospitals. Paxlovid was first authorized for use in the United States. Pfizer is expected to apply for emergency use authorization of its antiviral drug in the Philippines by the last week of January. While the Board of Investments has approved the application for registration of Lloyd Laboratories as domestic producer of Molnupiravir, an oral therapy for COVID-19 patients. Lloyd Laboratories recently expanded its production facility in Malolos, Bulacan. The project is expected to start this month with an estimated cost of 24 million pesos and annual production of 1,400,000 milligram capsules of Molnupiravir. Lloyd Laboratories also applied for a certificate of product registration with the FDA to make the drug more widely available. The suggested retail price of the locally made Molnupiravir is 65 pesos per pill, much lower than its imported counterpart, which sells around 100 to 150 pesos per pill. A Pfizer vaccine targeting the highly infectious Omicron variant will be ready by March. Pfizer CEO Albert Bourla says they are developing a shot that aims to give better protection against Omicron, as well as severe disease and hospitalization. Bourla is still unsure if the new vaccine will be needed, but says manufacturing has begun just in case. Other companies also developing Omicron-specific vaccines. The new variant also sweeping the United States. Millions of workers like teachers and hospital staff are stuck at home, isolating or quarantining because of Omicron. CNN's Nick Watts tells us this is fueling major disruptions to everyday life and the economy.
In Los Angeles, more than 60,000 school staff and students have tested positive in the run-up to reopening. In New York, trash lies uncollected, 3 subway lines are closed, so many city staff are out sick. Across Colorado, so many EMTs are out, they're now turning away some non-urgent callers. Upwards of 5 million Americans will be stuck at home over the coming days, says one economist, all down to the Omicron tsunami. Nearly a quarter of American hospitals are now reporting a critical staff shortage, with nearly 140,000 patients in those hospitals fighting COVID-19.
Much of our hospital workforce is getting knocked out at home with symptomatic COVID.
Some overwhelmed testing labs now forced to prioritize results just for the symptomatic.
Diagnostic testing is in shambles. And so when you add up all of that together, we've got a very serious situation facing our nation this month.
This country is now averaging a stunning 700,000 plus new COVID-19 infections every day, an all-time high and still rising. Thousands of schools didn't open last week after winter break due to COVID.
There was a staff shortage that led to the closure.
Others closed to slow the spread. Elsewhere, strikes because teachers want more safety measures.
I agree that the best learning happens in schools, but I don't feel safe at work right now.
One North Carolina district now telling some high schoolers to ride city buses because they're out of drivers for the yellow ones. Meantime, city bus services slashed in the likes of Washington, D.C. and Portland, Oregon. Cruises also being cancelled, and more than 25,000 flights cancelled since Christmas due to weather and Omicron. How long might all this last? Well, Alaska Airlines has cut 10% of its flights through the end of January.
It'll soon become easier to test for COVID-19 in the U.S. Beginning Saturday, private health insurers will be required to cover at-home tests, even without a doctor's order or prescription. Up next on Newsnight, it looks like fans of Emily in Paris can look forward to more of the show's romance and adventure, with new seasons confirmed. Details after the break.
Radio Philippines Network Incorporated, DXKO. 13:68 sa dial sa inyong radyo. RPN DXKO, ang Radyo Ronda dili sa Dakbayan sa Cagayan de Oro. Sibiyahan na may galaon sa katawan, andam na serbisyo sa tanan. Ang RPN DXKO Radyo Ronda sakop sa KBP, kapisanan ng mga broadcaster ng Pilipinas.
Let's go straight to the sources of the story. We have presidential aspirant and Manila Mayor Isko Moreno and his vice presidential running mate, Dr. Willie Ong Yorme. Dr. Willie, magandang umaga po sa inyong dalawa and welcome to the source.
Thank you, Pinky. Maraming salamat sa iyo at sa iyong mga staff dyan sa CNN. At kay partner Doc, Willie, good morning.
Good morning po. Yorme.
Okay. Okay, umpisahan na po natin kay Mayor Isko. Yorme, malakas naman po talaga yung ugong-ugong natatakbo kayo bilang Pangulo. And for the most part, sinasabi nyo na trabaho muna ang kailangan yung gawin, ano? I'm sure there are a number of reasons that push you to run. But if I were to ask you, ano ho yung top 3 reasons or things or circumstances that actually pushed you to run? And a follow-up question on that was, why was the declaration made yesterday? Dahil marami pong nagulat.
Okay. Thank you. Una, siyempre, alam mo, kung sarili ko lang ang iisipin ko, dito na lang sa Maynila, and we'll see the countries like, having so much trouble and challenges ng mga tao. Para bang nakakaawa naman na panoorin ko na lang yung laban. Nakalumo talaga ang tunay na sitwasyon sa baba. No? But be that as it may, this is democracy. I thought, okay, sige, we'll offer something for our people. Different things like, bilisan natin ng kilos and all other things. And fortunately, at salamat naman sa mga weeks of hinikayat natin si Doc na maging bahagi ng plano natin to really address our COVID situation in the country so that we can focus more on our economic recovery. Like in Manila, na partner ko, Doktor, at so far naman, sa awa ng Diyos, matagumpay naman yung partnership ng Mayor at Vice Mayor na Doktor. So sabi natin, tingnan natin niya yung si Doc Willie. Kasi nakikita ko si Doc Willie na mukhang may puso to sa tao on his own. On its own, kumikilos siya at hindi rin siya nagpapapigil. Kaya yun ang naisip namin. Sige, at salamat naman, umuo si Doc Willie. Alam ko marami rin nagkumbinsi sa kanya na tumakbong senador. Isa na nga rin ako doon. But we opted, diinan na natin to. Ipakita natin sa tao yung layunin natin, bakit tayo sasali sa halalan. Yung layunin na ang partner natin can continue to address the current situation with regard to health issue, so that most of our time will be dedicated in addressing future jobs for our people, certainty with our policies, and so on and so forth. So these are the things that the reason bakit kami nakipag-apply, kasama kaming aplikante sa mamamayan para sa pagpanguluhan at Vice Presidente.
Yorme, although meron pong sumusuporta, of course, sa inyo, meron din ho kasing nagsasabi na kaka-mayor lang, Pangulo na kaagad. Hindi man lang nag-senador, hindi man lang nag-vice president, diretso sa pagkapangulo. What do you say to those people who are saying na tila nagmamadali naman ata kayo?
Well, that's a good point. I respect that opinion. But let me refresh your memories that I've been serving the city and the government for 23 years of my life. I'm 46 years old. Half of my life was dedicated to public service. Second, remember, marami rin namang mga taong nahalal, nahalal na mga, by yung siguro nature or destiny. In the likes of Sumalangit Nawa, si Tita Cory, Si Tita Cory, nahalal ng tao, naupo ng tao, kahit na siya ay plain housewife, wala rin siyang experience, because yung trust ng tao. Kasi yun naman ang importante muna, yung tiwala sa iyo yung tao. At marami rin nahalal ng mga senador. Pinky, marami rin nahalal ng senador. Wala ring public office, or they are in a different age for a short period of time, then they got elected. So to cut the long story short, as far as I am concerned, I've been serving the public half of my life. No, I think that thing speaks for itself. Second, modesty aside, pinagskapan naman namin na yung kalugmukan ng Maynila sa mahabang panahon, naitaguyod naman natin, naibalik ulit natin yung tanyag ng pagiging kapitolyo ng bansa. In fact, we became competitive in the world, like in the Bloomberg philanthropy. Out of 263 cities in the world, we became top 50 finalists in that competition.
Yeah.
And including the national agencies of our country. Nung last year, despite the pandemic, binigyan naman tayo ng pagkilala. And in mga sertifikasyon ng pagpapatakbo ng gobyerno ng maayos, ng iba pang ahensya ng gobyerno. So in a short period of time, despite the pandemic, nagtuloy-tuloy ang buhay at pamamahala sa lungsod ng Maynila. And these are the things that we need, going against this pandemic na talagang mananatili pa sa atin hanggang 2022.
All right. So let me shift to Dr. Willie Ong. Dr. Ong, again, magandang umaga po sa inyo. Napansin ko po kahapon, tila wala kayong prepared speech. Ano po? May kinuha lang kayo sa parang polo nyo na maliit na papel. Some of the stuff that I remember na sinabi niyo po, wala talaga po ito sa inyong plano. And a lot will agree that this came from left field. Nagulat talaga yung mga tao na ikaw ang vice presidential bet ni Mayor Isko, no? Pero dalawa po yung sinabi niyo that struck sa akin. Sabi niyo po, maraming coincidence, at yung pangalawa, sabi niyo may kutob kayo kay Yorme. Ano ho ba talaga yung kutob niyo kay Mayor Isko? At nagdesisyon kayong sumabak at tumakbo bilang Vice President?
Yes, talagang pinagdasal ko maigi, tinitingnan ko siya maigi kasi marami na ako namimit na mga politiko doon sa mga experience ko sa 2019. Gusto ko makita kung talagang mabibigay niya, magagawa ba niya to, at pinagdasal ko maigi. Tapos nung nakita ko, right now I'm very confident he can do it. When I see him, I feel confident. Nakikita ko maganda yung partnership namin. Sinibigay niya sa akin na alagaan itong health sector, kung anong magandang na ibibigay sa kababayan natin, kung ano yung mga susunod na second generation vaccine. Kasi pipili tayo niya. Ano isasaksak sa ating katawan, pati sa mga anak natin. Papaaralin na ba natin sa school o hindi pa? Anong gamot ang ibibigay? Napakahalaga nito. Kung ano meron sa mayayamang bansa, sa Amerika, sa Europa, kawawa naman yung kababayan natin kung hindi natin ibibigay ito. Nakita ko nagagawa niya sa Maynila. And he's really very serious in studying lahat itong mga health problems. Pero kung matutulungan ko siya, sabi ko nga, okay naman ako kung sa Senado, pag-iisipan ko. Pero kung saan niya ako gusto ilagay, susunod lang ako.
Okay, pag-usapan po natin yung popularity. Sabi ni Mayor Isko, I'm neither the son or the daughter of a president. Ang dagdag niyo pa, walang mga avenues named after your family, kahit waiting shed. Sabi niyo nga, wala. Iisa lang yung pangalan na Domagoso. When you may seem popular, Yorme, sa Metro Manila, maybe sa Calabarzon, paano ho ninyo siguro i-introduce yung sarili ninyo sa mga taong posibleng hindi talaga kayo kilala sa mga liblib na lugar? Ang City of Manila ho ba ang magiging showcase ninyo para mapakilala kayo sa mga taong hindi kayo kilala?
Well, what happened to Manila is just one thing. Siyempre gusto ko rin ma-meet, makilala ako ng mga tao doon sa bundok ng Tralala, sa talagang sulok ng bansa. And we have that kind of commitment that we will go to them and try to be reasonable and express our intention, state our intention to the far-flung areas of our country. And I hope I will be given a chance. But then again, Pinky, hindi naman to Mr. and Mrs. Congeniality competition. Hindi naman to Mr. and Mrs. Universe. This is about the lives of our people. And history or things that you have done in the past or even records of what you have done is an asset also that can be shared to every Filipino. Yun naman ang akin, ipagtatapat ko naman kung ano yung nagawa sa Maynila at ano yung mga pangarap natin at yung karakter natin, because tingin ko nowadays yung values ng isang kandidato at saka yung kanyang mga karanasan isa sa mga pwedeng maibenta sa ating mga mamamayan bilang aplikante. When you try to apply for a job, di ba? Tinitingnan yung experience mo, tinitingnan na pati mga yung educational background mo, tinitingnan nyo, sinisiyasat yun. Or tinitingnan din nila, who are you as a person? No? So meron kang experience, medyo sana pumasa ako sa academic background na requirements nila. Tapos yung point of use, that's very important because it's going to be a policy. Remember, we all know that halos lahat ng lumalabas bibig ng leader, it became a policy. So that is very important in job interview, during the job interview. Ayun naman ang gagawin naman natin. And I hope my fellow Visayan, by blood, Pinky, I am 100 Bisaya. Hindi mo lang makikita sa akin, at hindi ko naman yan ikinubli, but my father is from Panay Island, Antique. My mother is from Samar. Sila ay mga biktima ng neglect ng nakaraan. Katulad din ng mga ibang kababayan natin sa probinsya. Kasi kung naging mabuti ang pamahalaan sa kanila nung araw, ay hindi sila pupunta sa Manila para mag-squatter at magbakasakali. So I am the product of that. And it's very clear of the connection. So if we can make it better there, in the provinces, in the far-flung areas, sa mga bundok ng Tralala, wala nang pupunta sa Maynila at para magbakasakali at mag-squatter dito na mas mahirap ang buhay. So if we can send that kind of message and hope, or at least put into action, hindi lang yung lip service, then I think there will be an equal opportunity anywhere in the country in the coming future.
And speaking of popularity, I also want to ask Dr. Willie Ong. He's very popular on Facebook. You have 16 million followers. Sa YouTube, ata 6.5 million ang iyong followers. However, tumakbo kayo in 2019, and obviously, while you made it to number 18, obviously hindi po kayo nanalo. How do you plan, siguro sir, Dr. Ong, to translate this popularity on social media? How do you plan to translate that into votes in 2022?
Siyempre, I'll just be myself. Gagawin natin yung kaya natin, and I'll be joining Mayor Isko sa mga pupuntahan niya, sa mga interviews niya. And I learned a lot in 2019. I learned a lot about politics, the good points, the bad points, and maraming lessons doon are very important. And I'll be taking those for 2022.
Kailan ho kayo mag-o-officially resign sa Lakas CMD, sir?
I think they have talked already with Lakas CMD. Actually, I wanted to stay in Lakas CMD, but I'm not sure what is the process there. So if I have to resign, I will join Mayor Isko's party.
All right, we need to take a very short break. The Source will be right back. And you're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, Manila Mayor Isko Moreno and Dr. Willie Ong. Just very briefly, I want to touch on this to both gentlemen. Really, the choice of Mayor Isko was Senator Grace Poe. Sabi na po ni Mr. Lito Banayo, you tried and tried, but in the end, she said no. I wanted to ask you both, do you think this is divine intervention or maybe even destiny that because humindi po si Senator Grace Poe, ay kayo po, Mayor, naghanap ho kayo ng ibang partner. Because if it was Senator Grace po, obviously, hindi po top of mind yung isang tao, vice presidential bet na mangunguna sa COVID response ng gobyerno sakaling manalo kayo.
Alam mo, ang maganda nga minsan, alam mo, yung sinasabi ko lagi, ang mga pagsubok sa buhay teaches you lessons. And from the lessons, you will learn. Ang maganda naman, pag nadapa ka, bumangon ka agad. And these are the things that we need in the coming days, months, and weeks, and years of our lives dealing with pandemic. Tama yung sinabi mo. Alam mo, sinabi ko rin yung kaila Doc Willie noon. Sabi ko, siguro talagang sinasadya ng tadhana, no? Na from with all the challenges, no, dealings with some leaders of our country, then here we are. Pinaglinaw ang isip natin. No, why not? Then we analyze it. What are the challenges of coming days? And science will agree with us that pandemic or COVID-19 will stay. So, tingnan natin. We offer something. And I agree with you. I do believe in God. Naniniwala ako kay Jesus, no? Kay Mama Mary. Baka nga mamaya, hulog ng langit itong sitwasyon namin ni Doc Willie to really offer something different. And the thing speaks for itself. No? Doktor, Vice President, tapos Presidente, may karanasan, no? May managerial skills. No? At battle, modesty aside, I think Dr. Willie and I are battle-tested in the COVID situation in our country. In his own world, in our world, here in Manila. Kaya I would think that way, that maybe God intervened. Hopefully, I'm not using God in this conversation, but sa'yo na rin naman ang galing, maybe nga, may awahan Diyos.
Si Dr. Ong, I'm going to change the question naman. Meron po kasing si political analyst, si Dean Tony Lavinia. Ang sabi po niya, stroke of genius daw itong partnership na to. I believe he was the one that said that because bago, out of the box, kumbaga nga. Kayo ho ba confident? That's what I want to know. Are you confident with such a team up that this will actually change people's perspective na nakasanayan na ang binoboto ho talaga mga politiko na presidente at vice president. This is obviously, again, to use the term out of the box, are you confident that this will allow people to gravitate towards Isko Moreno and Dr. Willie Ong tandem?
For me, Pinky? Yes, ang focus ko lang, Pinky, talaga, if Mayor Isko wins for the next 6 years, ano magagawa natin? Specifically sa health sector. So iniisip ko na kung anong gagawin, ano yung COVID response natin for health workers, hospitals, medicines, vaccines, especially yung trust ng people, yung pronouncement. Like for na, mababa yung vaccination rate natin. So, iniisip ko na anong magagawa natin in 6 years, maybe a new infectious disease hospital, we need a Center for Disease Control para dito sa atin. So, very neglected na yung health sector. After the health sector, we are studying the whole program of government. 5 hours na kami nag-aaral itong bilis kilo. So, we're really studying and ready for entry.
Doc Willie, I will follow up na dahil napaka-importante yung mga sinasabi niyo. For example, Philippine Genome Center, hindi ho ba, nasa Luzon, kailangan natin sa Visayas and Mindanao. They were asking for 100 million peso budget, 50 million Visayas, 50 million in Mindanao. RITM, pinag-usapan na rin po, you mentioned that, mga hospital, nurses, etc. But very important, yung sinabi niyong vaccine. Sabi niyo, ituturo ko sa inyo yung pinakamabisang bakuna. Ano ho ba para sa inyo ang pinakamabisang bakuna ngayon?
Ang pinakamabisang bakuna, yung darating na bakuna, yung second generation vaccines, yung may panlaban sa Delta variant, di ba? Yung ngayon, pag-iisipan natin, booster, no booster. I'm just saying, we will get the best science, na tingin namin, we will get the best experts, kilala ko to, and we will decide based on ano ibibigay ko sa pamilya ko. Di ba? Not based on other factors. Alam niyo na naman anong other factors eh. Kailangan doktor ang magli-lead nitong COVID response.
But isn't that also, do you see the challenges of that being such a tall order because of the inequity, yung kulang po ng mga bakuna sa mga nagtatanong bakit madaming Sinovac? Dahil Sinovac po, ang milyon-milyon na nagdala ng bakuna dito. Some, of course, favor Pfizer, maybe even Moderna, but it seems the problem is the lack of supply. How will you be able to, even as a doctor, nasabihin po natin, for the sake of argument, sabihin na mas mabisa ho talaga ang Pfizer, kunwari lang po, or Moderna, pero dahil po may kakulangan ng bakuna, baka hindi din po talaga mapunta sa bansa yung mga the best, kunwari po, na bakuna. How do you intend to solve that?
Yes, tama po. It's very possible na hindi tayo mabibigyan nito mga best vaccines, pero it will not be from lack of effort. Talagang tututukan ni Mayor yan. Ngayon pa lang, intention to order na tayo. Kung dito lalabas, siyempre pupusta na tayo o order na tayo dito. Depending paglabas ng stats, o order na tayo dito. So based on what is best for our people, we will do our best. Okay lang naman sa tao, we try to get this medicine, pero it's not available. So ito na lang. Pero yung masakit, yung hindi mo sure kung kinuha pa, hindi ba kinuha. So yung trust pag nawala yung trust ng mga public at doon sa mga doctors na maggagamot sa kanila, mawawala. Kung nawala yung trust, hindi gagaling yung pasyente. Magugulo lang tayo. So maybe I can offer that. Having said that, I'm not saying anything against the government. They are doing their best. Maybe we will just do it different. Ibang style ni Yorme, iba rin naman ang style natin para pagsasama. Maganda po teamwork namin.
Yeah, just to follow up, when sinabi niyo po during your speech yesterday na nakita niyo po yung mga healthcare workers natin umiiyak, plain and simple, sakali pong manalo si Mayor, manalo po kayo, alam naman po natin yung problema ngayon, yung current problem. Mababa po ang sahod, hindi po nila nakukuha yung kanilang mga benefits. Is there a commitment from you, dahil nga para kayo ho ang mangunguna ng health issue natin from you, number one, tataasan ang sweldo ng mga healthcare workers, at number two, siguradong mabibigay po yung kanilang mga benepisyo.
Sigurado bibigay ni Yorme yan at hindi lang yan. Siyempre gusto natin libreng dialysis, diba, sa mga hospital as much as we can. We're not promising anything 6 months, 12 months. Kung ano yung kaya, ano makukuha natin na pera, talaga ibibigay natin yan. Especially the medicines sa mga primary care, sa mga health centers. Siyempre dapat puno ng gamot. Hindi naman pwede patingi-tingi sa mga kababayan natin. So focus namin ni Yorme, which is very similar, yung aabot on the ground. We don't want PowerPoint presentation, magre-relax lang dito, tapos na gusto natin maramdaman ng tao na sila mismo matutuwa at magpapasalamat sa atin, sasabihin, ay tama pala siya ang pinili ko.
We need to take a very short break. The Source will be right back. Well, you're watching The Source on CNN Philippines. I'm Pinky Webb. We're going to have to say goodbye now on television. The Source is really just 30 minutes long, Mayor and Dr. Willie Ong. So we're going to say goodbye on television. Pagpapatuloy po natin to sa Facebook. So thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.
RPN, Radio Philippines Network Incorporated, DXKO. 1368 sa dial sa inyong radyo. RPN DXKO, ang Radyo Ronda dili sa Dakbayan sa Cagayan de Oro. Sibiyahan na may galaon sa katawan, andam mo serbisyo sa tanan. Ang RPN DXKO Radyo Ronda sakop sa KBP, kapisanan ng mga broadcaster ng Pilipinas.
Ito na nga mga kaibigan, balik po tayo sa ating programang Trending ngayon. Siyempre, kasama niyo pa rin po ang inyong lingkod, Judith Estrada Larino. Eto muna ha, eto ay nag-trending mula po sa ibayong dagat. Nako, pala ang ilang Pilipino sa pagkawala po ng internet services dyan sa Kazakhstan na naging dahilan naman po ng 5 araw na blackout. Grabe naman. Kailangan pa naman ang mga internet service, ano? Ilang araw pong nabalot ng dilim at walang internet service sa lungsod ng Almaty dahil po sa sunod-sunod na karahasan doon. Subalit, ika nga, there's rainbow after the rain. Kaya daw po sa mga kababayan nating nasa Kazakhstan, makinig po kayo ha. Dahil meron pong ibibigay na ang isang telco ng libreng calls, text at data para po sa kanilang subscribers. Ayan, inanunsyo nga po nitong Globe na extended po ang kanilang libreng 15-minute calls at 15 text to all networks. Bongga, ang dami na nun. Pati na rin po ang free 1 gig data. Ayon po sa telco, kailangan lamang mag-connect sa roaming partners nila tulad ng Bailin o itong Cartel at Mobile Telecom Service na LLP para po magamit ng mga kababayan natin dyan sa Kazakhstan ang nasabing libreng roaming services. At hindi talaga, no, pagka ang problema ay internet dahil lahat ho ngayon talaga namang mas mabilis ang komunikasyon sa pamamagitan po ng ating internet services. Ang magiging kalaban mo lang dyan kung may signal o wala. Tsaka yung mabagal no? Yung iba kasi mabagal, yung iba naman mabilis. Sabi nga nung isang kakilala natin, ba't ganun? Ang bilis na nga nung kinuha kong ano tawag doon, plan, pero ang bagal pa rin. Ako, sayang naman daw yung bayad niya. Anyway, ito mga kaibigan, sa oras pong 6:53 ng gabi, ito naman, ako, isang madugo din ito, no? Pickup truck nilamon ng cyclone. Ayan, ha? Diyan naman po ito, sa Australia. Nako, hindi nga po nakayanan ng isang pickup truck ang naglalakihang alon. Dulot po ng sama ng panahong naranasan dyan sa Australia. Kitang-kita po sa viral video ang buong paglamon. Nako, ng malalaking alon sa nasabing pickup truck na inanod sa gitna po ng dagat pa mismo. Delikado, no? Nananatili pong matataas ang alon sa mga beach doon, dito nga sa Australia, no? Kahit mabuti na ang panahon, samantalang napaulat din ang mga insidente ng pagkalunod at pagbaha. Yan. So, dapat kung hindi na rin lang naman, kung alam na rin naman natin, makikita mo naman, kamado na rin, lalo na ng mga driver na, hindi maganda ang panahon, maaring ipagpaliban na natin yung ating gagawin, no? Kasi sumuong tayo sa ganyan, kitang-kita mo naman, no? Di ba? Wala na mangyayari. Tayo po'y talagang sumuong na sa disgrasya kung mangyayari yan. Tandaan mga kaibigan, sa oras ng mga 6:54 ng gabi, dito pa rin po sa ating programang trending ngayon sa araw ng Martes. Ito, nako, 1 in 2 million chance. Ganito po ang taguri sa fraternal twins ng isang couple sa Greenfield, California, USA. Ayan, ipinanganak po sa magkaibang taon sa halos 15 minutes lang ang kanilang pagitan. Ibinahagi po sa Facebook ng Natividad Medical Center ang pagdating ni na Alfredo Antonio Trujillo ng 11:45 ng gabi ng December 31, 2021 at itong si Eileen Yolanda Trujillo ng 12 midnight, eksakto naman, ng January 1, 2022 na siyang tinaguri ang Baby of the Year ng ospital. Kasi siya yung nauna. Eksaktong 12:00 pinanganak, yung kapatid niya, si Alfredo Antonio, 11:45. So, 15 minutes nga lang yung pagitan nila. Ayun po sa nasabing ospital, bibihira daw po para sa mga twins na magkaroon ng magkaibang birthday o sa kanilang pagtaya ay nasa 1 in 2 million. Kaya pala ang sabi ng mga doktor dyan sa Natividad Medical Center, 1 in 2 million chance. Tuwang-tuwa naman po ang doktor ng mag-asawa sa anilay sa anyay pagiging bahagi niyang mailabas ng ligtas sa mundo ang twins sa 2021. Ang galing naman niya, no? 2021 tas 2022 rin. Magkasunod pa. At tinawag niya itong amazing year to start the new year. Yan. So, yan po yung tinatawag na fraternal twins ng isang couple dyan sa Greenfield, California, USA. Ang pagitan lamang ay 15 minutes. So, ang tawag nga nila ng mga doktor dito sa Natividad Medical Center ay 1 in 2 million chance. Yun. 11:45 si Antonio, 12 ng December 31, 2021, bago maghiwalay ang taon. Si Eileen naman ay ipinanganak ng eksaktong 12 midnight ng January 1, 2022. At siya pang tinaguri ang Baby of the Year ng nasabing ospital. So yan. Yan po mga kaibigan ng ilan sa ating mga trending news for today. Ulitin lang ho natin yung mga naapektuhang Pinoy dyan sa pagkawala ng internet service sa Kazakhstan. Huwag ho kayong mag-alala dahil kahit na nabalot ng dilim at wala kayong internet service sa loob ng ilang araw, magbibigay daw po ang Globe o i-extend nila yung kanilang libreng 15-minute calls at 15 text sa lahat po ng networks, pati na rin ang free 1 gig data. Ayan. So yung mag-connect lamang doon sa kanilang roaming partners, yung Cartel, Beeline Cartel, tsaka yung mobile telecom service na LLP para po makapag-avail ng nasabing mga libreng roaming services. So mga kaibigan, sa oras pang alas 6:58 ng gabi, una po natin ang ating verse of the day. Mula po sa Omega Digi Bible, tampok po sa ating verse of the day, ang mga labi ng matuwid ay nagpapakain ng marami, ngunit ang mangmang ay namamatay sa kakulangan ng pag-unawa. Wikaan Jess sa 21. Ang 30 minuto ng ating programang trending ngayon. Unang-unang pagsalang natin sa linggong ito. Ayan, maraming salamat po sa Diyos sa awat tulong niya. Sa pagbibigay po ng pagkakataong tayo po'y magkakwentuhan. Simula kaninang alas 6:30 ng gabi. Siyempre, nais din nating pasalamatan ng mga nakaagapay natin sa News Center, sina Hyacinth, sina Abby 1 at si Abby 2. Bongga, meron kaming 1 and 2 dyan, ha? Sa Ate Hia, si Micah, and of course, si Maisie. Ayan, sa social media, nandyan po kanina sina Joanna, si Kimi, si Allen at si Jello. Siyempre, ang ating poging piloto, ayan, Engineer Fred Belamala. Susunod kaibigan, ang programang Radyo Klinika, kasama po si Miss Marupa Hati Sarne. Uy, salamat din pala kay Emmanuel Macose. Saka kay si Kuya Jan, ang birthday kahapon Wala pang blowout, no? Antabayanan niyo mga kaibigan, ha? Radyo Klinika. Open po bukas, magkasama tayong muli hanggang 6:30 to 7 ng gabi. Ako po ang inyong lingkod, Judith Estrada Larino. Ingat po tayong lahat. Bye!
Trending ngayon.
Radio Philippines Network Incorporated, DXKO. 13:68 sa dial sa inyong radyo. RPM DXKO, ang Radyo Ronda, dili sa Dakbayan sa Cagayan de Oro. sibiyahan na may galaon sa katawhan, andam mo serbisyo sa tanan. Ang RPN DXKO Radio Ronda sakop sa KBP, kapisanan ng mga broadcaster ng Pilipinas.